Hello everyone, my name is Autumn Hamilton. I'm the founder of Happy Horizon Small Animal Rescue located in Cincinnati, Ohio, and I also just started this YouTube channel covering different small animal topics. And today's topic is going to be all about diabetes in hamsters. So I know a lot of you have probably heard about hamsters having diabetes, but we actually have one in the rescue. Her name is Sweet Tea, and this is her. You say hi? Yeah, she's a little pancake. I call her my little maple pancake because she's always so flat and she smells like maple syrup. So, and I'll get to that. But yeah, so a lot of people have become very interested, since we do have a diabetic hamster, on how to properly treat it and how to recognize it. So we're going to go over it in this video. So a lot of you may know what diabetes is. You may know relatives who have diabetes, or you might have like dogs or cats that have had diabetes. But hamsters, just like any other small mammal, they can also get diabetes. And it's harder to recognize because a lot of people don't get vet care for their small animals, so they don't recognize that it's an issue. But we're going to go over the topic in today's video and kind of go over the signs, how to treat it, and all that stuff. So I'm going to start off with just kind of listing off what diabetes is. For those of you who don't know what diabetes is, it's when the pancreas can't produce enough insulin to deal with all the glucose or the sugars in the body. And if the pancreas can't produce enough insulin, the glucose kind of builds up in the bloodstream and starves the body of energy. Glucose is a big source of energy for mammals, so it's very important for them. So there are two types of diabetes. It's kind of hard to tell what kind, if it's type 1 or type 2, if your hamster's type 1 or type 2, just because they're just so small. It's hard to tell if they were born like that or if they kind of developed it over time. Most of them who get it had some sort of predisposition for it. But type 1 is when the pancreas can't produce insulin, and that's kind of the one where they're kind of just born like that. So unless you get your hamster really young and get on top of it, you probably won't know if it's type 1 or type 2. But then type 2 is when throughout their life the pancreas kind of stops producing insulin, and then they start having a lot of trouble. So dwarf hamsters are the most prone, or it's most recognized in dwarf hamster species, of them getting diabetes. So I always tell people to keep their dwarf hamsters' diets low in sugars and stuff like that, so that way if they do have a predisposition, they'll be less likely to get it. So let's talk about some of the symptoms or some of the signs you'll notice that might make you a little suspicious that your hamster might have diabetes. So the first one I noticed when we got Sweet Tea was the excessive thirst. So they will drink a ton of water. Like she was drinking, and I'll put a picture, she was drinking I was filling her bowls of water twice a day, and she had a water bottle. I measured it, and she was drinking about 50 mLs of water, which is a ton of water. And because they drink so much, they pee so much. So luckily, Miss Sweet Tea, she's super nice, and she uses the sandbox like a litter box. So she makes it all kind of tidy and easy for me. It was easier for me to tell that she was diabetic because she had so much. She would literally like fill up her sand bath with urine, and I completely dumped sand baths for her. She has 4 in her enclosure, and I completely dump the ones that she uses at least once a day. Put new sand in there so that way it's nice and clean. the main things you're going to notice is just drinking and peeing a lot. I'm going to try to put a picture of kind of what her litter box looks like. It was really pretty obvious because she's so tiny, and my other hamsters did not drink or urinate nearly as much. And then another thing you'll notice is weight loss, actually. So their bodies, when they start to not be able to cope well with the diabetes, they start losing a bunch of weight, getting kind of thin, their bodies aren't coping well. Their urine will actually get kind of like a sugary, sweet smell. One of the reasons why we call her Little Maple Pancake is because my boyfriend says her pee smells like maple syrup. I think they're just trying to get rid of so much sugar, so it smells so much, but at least it doesn't smell horrible. But you'll notice their urine will smell a lot different than a normal hamster's, and you'll also notice if their bodies aren't coping well, they'll become either really lethargic or like really hyperactive, where they just can't settle down. So if you notice a few of these signs, or you're suspicious, then you need to book a vet appointment. And then your vet might tell you to do a few things at home to kind of tell too. So one thing you can do in the meantime, if you are suspicious, is you can catch a urine sample. So to catch a urine sample, it's going to sound really hard, but actually, if you just clean out your travel carrier, just a plastic travel carrier, and kind of wipe it out good, so it's nice and clean, try to make it as sterile as possible. I know it's kind of hard. It doesn't matter too much, but for this reason, but just kind of clean it out and then set them in that travel carrier with nothing in it, no bedding or anything, because you want that pee to not get absorbed. So you put them in there, you wait a while, and diabetic hamsters, they pee very frequently, so you probably won't even have to keep them in there more than like 30 minutes, but I kind of just wait until she pees, and then there's a big puddle, and then I use either a little syringe or a little pipette, and I kind of suck it up, and where are you going? But yeah, I suck it up, and then I put it in the tube, and then I use keto dye sticks. They're like, they check ketone and glucose in the urine, so then you'll, with the urine, you'll test, and if there is a lot of glucose, or definitely if there's ketones, that will let you know that they are diabetic, or that they could be diabetic. So especially if that's popping up, then it's definitely a good idea to book a vet appointment and get that addressed and looked at. All treatment should be monitored and prescribed, and medications prescribed, and everything done by the vet. So it's very important if you notice anything like this to get it checked out right away. Okay, so now we're going to go over how to treat diabetes in hamsters. So not always, they usually won't start off with insulin right away. Yes, hamsters can get insulin, it's crazy, but yes, they can. But that's usually not the first thing that they jump to when treating for diabetes. They usually like to start with a diet change first. So you're going to want to get a food with very low sugar, not a lot of corn, not a lot of dried fruits. And then you'll also want to try not to feed them any treats with sugar, or fruits or veggies that have a lot of sugar. So you can stick with like leafy greens, broccoli. Broccoli is her favorite. Mealworms, she loves mealworms. Just other snacks that don't have a lot of sugar, they can have that. But usually starting off with that, we kind of base it off of how they're acting, and that'll tell us if the diet change is enough or if it's not. So if they start drinking and peeing a little less, they're acting fine, then a diet change will probably be fine, but you do need to monitor their urine and stuff and their weight every week to make sure that they're doing well. And then you'll also want to look out for, which I will put a picture of good foods here in the US that you can get for diabetic hamsters, but you want to try to go for also foods in lab blocks that don't have a lot of honey in the food. Some of the lab blocks have a lot of like honey or molasses, so we want to try to stay away from that. And then you can also, which I do for her, I add fenugreek seeds to her food, just a little pinch in her food every time I feed her. And I'm not sure if it really does anything, but I've heard that it can help with the excess sugars in the urine and in the body. So I kind of give that to her as well to kind of help as a supplement. So another thing you're going to want to keep track of, and when you're treating a diabetic hamster, is that they're getting enough fluids. So they are really prone to getting dehydrated. Their bodies, they just need the water. They're trying to get as much, filter as much of the glucose and sugars out of their bodies as they can, so they can get dehydrated really easily if they're not drinking enough. And you can kind of check for dehydration by kind of pinching the back of their neck here, and then hers goes down pretty quickly. So she's hydrated. She actually had fluids this morning, and I'll talk about that in a minute. But she did have a lot of issues with being dehydrated. She's been hospitalized twice due to being dehydrated, and she kind of just collapses. And at first we thought it was like a sugar issue, but it turned out she was just really dehydrated. So now that we know that she has a dehydration issue and that she isn't drinking enough on her own, we give her sub-Q fluids twice a week, and she actually got some today. She does really well with them. She's used to the pokes for her insulin, so she doesn't mind too much, but it definitely makes her feel so much better. Like, she's acting pretty much like a normal hamster now that she's getting fluids and insulin. So she's doing really well with that, but that's just a big thing you got to look out for, is just if they're acting lethargic, losing weight a little bit, or if you pinch their skin and it kind of stays up, that's not good. That means they're dehydrated and their skin's really sticky and they need water. So definitely get them to the vet if you notice they're dehydrated, to get that addressed. It's kind of hard to do sub-Q fluids on hamsters if you're not experienced in giving sub-Q fluids and giving injections on small animals. So be sure to check with your vet to see if that's a thing that they would need. So like I said before, not all hamsters need insulin. Some do well with diet, but if they do start needing medications, which is insulin, the main thing that I noticed that kind of triggered my vet to start insulin was she started losing weight, and then she was acting lethargic, and she started getting ketones in the urine. So we were checking urine. We do check urine once a week on her to check the amount of glucose and ketones in the urine, because if ketones are showing up in the urine, it means that their bodies aren't coping well with the diabetes and something needs to be addressed, especially if they're starting to do poorly. So that's how you kind of tell if they're going to need it, is if they start doing poorly and it kind of just is like, okay, we're going to have to do it, or like you're gonna die without insulin. So we did start Miss Sweet Tea on insulin, and she's been doing very good. She actually gets a lot, what you would think would be a lot. She gets 2 units twice a day, sub-Q injection, and she does really well with it. We started out with 1 unit. 2 units is usually the maintenance dose for hamsters, so she wanted to start off with 1 and just make sure that she did well with it, and she did. So we went up to the maintenance dose of 2 units, and she's been doing really good ever since. She doesn't drink her pee as much. I wish she would drink more just because she needs to, but she's getting sub-Q fluids, so I feel like she's like, I don't have to drink. Why would I drink when you're just poking me and I'm getting water for, like, I don't have to put effort in. But yeah, so insulin is going to be like closely monitored by a vet. So if you do start insulin, it's all going to be based on your vet, and you're going to have to be very careful. You need to make sure, go through an insulin lesson with your doctor. If you do need to start doing insulin, make sure you're doing the right dose. Some insulin syringes, it's hard to tell what is 2 units and what is not, or what is 1 unit. So you have to be very careful. Giving too much could kill them, so you have to be very careful, but it does benefit her having it, so we'll of course do it. She's been on insulin for probably 4 months now or so. Yeah, she's been doing really good, but yeah. We will move on to kind of the long-term effects of and kind of the side effects of having diabetes. So diabetic hamsters are usually more prone to having like heart disease, heart issues, kidney issues, and a lot of UTIs. Sweet Tea does actually have she has something wrong with her bladder. Every once in a while she kind of leaks blood a little bit from her rear, and we do antibiotics periodically just in case it's a bad UTI, because they're drinking and peeing so much they're more prone to getting UTIs, and hence also having urinary issues in general and having kidney issues. So she's been doing pretty good though. We get blood sometimes, but the doctor's like, she's diabetic, she has enough issues, we're not doing crazy stuff like surgery or anything if it was a bladder stone. So there's a chance she could have stones or a raging UTI, but we're kind of periodically treating her for that. But that's another thing you'll probably have to worry about, is a lot of urinary issues, cataracts, blindness. You can see she might be starting to have a little bit of trouble. Her eyes are getting kind of more red and a little bit more foggy, so she might be having a little bit more issues with her eyes. And when they're not properly regulated, like before I got her, I don't know how long she was having these issues before I got her, so the longer they're not regulated, the more chance of them going blind and having cataracts. But yeah, and then also the main thing is just rapid weight loss. Like I said before, like when I knew she needed insulin, she started losing weight like crazy. She was looking really frail. She wasn't lively. She just wasn't looking great. And yeah, so this kind of concludes this video. I just want to end the video by saying that just because a hamster has diabetes does not mean that they don't have a good quality of life. A lot of people have said, why don't you just euthanize her? Is she really that worth it? And honestly, yeah, I mean, their lives are so short, but I mean, every day counts, right, Sweet Tea? She said, yeah, every life counts. So yeah, even though it might be a bit more effort to take care of them and to care and just do a ton more monitoring compared to a regular hamster, it's just so worth it. And we're gonna make every day count, aren't we, Sweet Tea? Yes, we are. Alright, I hope you guys have a great rest of your day, and we'll see you in the next video.